This session features the esteemed speakers, Mr. Hisham Al-Rubi, President of Ittijah, Ms. Dr. Fatin bin Abdulaziz, Unit Head, Enhanced Wellbeing Unit, Department of Health Promotion Division of Healthier Populations, WHO HQ, Vito Intini, UNDP Regional, and this session is moderated by Dr. Rhonda Ferris, Minister Advisor for Family Health and Development and National Director for Mawadda Program, Ministry of Social Solidarity. The floor is yours.
Good afternoon, everyone. It's my utmost pleasure to be moderating today's session, Community Engagement for Sustainable and Inclusive Development. Thank you all for being here today, and let me start by welcoming our esteemed panelists, who I'm sure will be sharing a wealth of knowledge and diverse perspectives to our discussions. Mr. Jamal Sanan, Eagle Films Production, he will be joining us shortly. Mr. Hisham Rubi, President of Ittijah, Mr. Vito Intini, UNDP Regional. Community engagement is essential for fostering vibrant, resilient societies. It basically has to do with actively involving individuals and groups in decision-making processes, ensuring that their voices are heard and valued. This collaborative approach not only empowers citizens, but also strengthens the coherence of our communities. Engaging with the community allows us to understand diverse perspectives, build trust, and cultivate a sense of belonging. It enhances transparency and accountability, enabling more effective responses to local needs and challenges. Moreover, when individuals feel connected and invested in their communities, they are more likely to contribute positively, driving social change and innovation. In today's rapidly changing world, the importance of community engagement cannot be overstated. It serves as a foundation for sustainable development, social cohesion, and collective action, ultimately leading to stronger, more inclusive communities. As we explore this vital topic, let's reflect on how we can further enhance our engagement efforts and create meaningful connections that benefit us all. Let me start by asking Dr. Fatin bin Abdulaziz, how does the WHO promote community engagement in global health initiatives, and what are some of the key challenges and opportunities in this area?
Thank you very much. And before responding to your question, I would like to thank the organizers for the opportunity to present the work of WHO. Shall we stand here or can we stand up? So a very good afternoon to all of you. So as you mentioned, Doctora, community engagement is a critical and essential component of the work that WHO does. In the next slide, I wanted to somehow put a bit of a context in which this discussion will take place. We spoke about community engagement, we spoke about sustainable development, of human development, but we also spoke about inclusion. In WHO, all the work that we do is part of the SDG agenda. And the intersection between the different goals is what makes sustainable development. We cannot talk about sustainable development without talking about education, without talking about employment, without talking about issues related to climate change, the digital transformation. So when we speak about community engagement in a sustainable and inclusive manner, we would need to discuss or think about how we are going to engage the community in light of the SDGs. In WHO, as you know, we work on the WHO General Program of Work, and recently member states have endorsed the 14 JPW. The 14 JPW, as you can see in the slides, talks about the health of the people and the health of the planet as being interconnected. and looking at public health measures and community engagement in both ways, looking at the environment, planetary health, as well as looking at the population health. For all of these actions that have been agreed by member states, community engagement is integral. We don't think only about consulting with the community, talking to the community, but how do we engage the communities to co-design and co-implement the interventions? In 2021, WHO organized the 10th Global Conference on Health Promotion. In that conference, we mentioned again the importance to talk about the health of the people and the health of the planet. At that time, the participants of the conference endorsed what we call the Geneva Charter. And Geneva Charter talks about the transition that are requested from governments to really cope with the challenges post-COVID. So WHO was mandated by member states to integrate what we call the approach of well-being into public health. What does it mean? It means that so far when we have been talking about health, we have been talking about diseases or risk factors. But health is a positive status. And we need to act and work with the communities before the community gets sick. What the framework offers is, again, strategic directions that cover all the aspects that I just mentioned. We need to have policy and programs that will protect our environment. We need to have social and protective measures and welfare. We need to have economies, because when we speak about sustainable development, we need to think about the economic models that we are using. And these economic models have to be equitable. We need to talk about how digital transformation has been affecting our daily life. If we ask how many persons do not have a smartphone, I think all the hands would be down. Digital transformation is affecting the way we work, the way we study, and the way we seek help. We also talk about, of course, actions to promote universal health coverage through primary health care. So basically, talking about sustainable development is about talking all these actions. The area that I focus on, that I work on, is health promotion. The very definition of health promotion is about empowering people. It's about including people to take action. So we expect people to really take action. When we speak about community engagement, we speak also about processes. So it's not an outcome per se. It's about putting in place everything for people to be engaged. So engaging the community is not a question of goodwill only. And we need to put in place mechanisms. So to respond to the question earlier, what does WHO do to engage community? So we have different approaches. We use first the healthy settings approach. As you know, we believe that health promotion has to be implemented in everyday aspect, everyday life aspects, in schools, in cities, in workplaces, in hospitals. So we call it the healthy settings approach, where you mobilize the people working there. But we also have social mobilization. Social mobilization for the common good is about allowing communities to organize, co-design, and implement the interventions. But for this to happen, you need to make sure that the community has the right level of health literacy. If the community is not aware of the health impact, how would you mobilize the community to be engaged to find some solutions? You also need to have in place mechanisms for engaging the community, and I will cite some examples later on. You need to engage the community in defining an agenda, and this takes time. In the work that we have done in several countries, when we spoke with academic partners, local partners, very often it was the engagement of the community was sometimes defined as a one-time meeting. That's not the way it takes place. You need to go through a process. You also need to enable the community to implement what they would like to see in terms of solution. And when you do that, you build resilient community, because it's like education. Once you gain the education, they cannot take it away from you. Once you empower the community to take control over their health, you give them the assets, you give them the mechanism for dialogue, and then you create a community that is engaged in your public agenda. So these are the different health promotion tools that are being used for community engagement. When you speak about engaging the community for advocacy, you think about the political commitment of the decision makers. When you involve the community in mediation, you really talk about co-designing, understanding the different issues at stake. When you speak about community engagement for social mobilization or action, this can take place, for example, in campaign and social mobilization for vaccination campaign, for instance. But again, here where I would like to make an important point is that you need people to be informed. So you need to make the information for them to take the decisions available. So basically, engaging the community or enhancing community engagement is a critical function of public health. It's integral to health promotion work that we do, and it takes place at national and local level. I would like to give you some example of initiatives that we have done in WHO to give you a concrete picture. So as part of the Healthy Cities initiative, we work under this project called Urban Governance for Health and Wellbeing. And this is an example where we are working in Douala, where there is a cholera outbreak. When we worked with the communities, we said, and the municipality, we said, okay, so we want to avoid the cholera outbreak. What do? We cannot have a solution by the municipality. And the communities there organize themselves in small committees to actually address the issue of clean water. In my second example, it's in Bogota under the same initiative. The community engagement was done through a local civil society organization where they were dealing with issues of disabilities and obesity and overweight, but they organized themselves around the different NGOs taking place there. Because as you know, in Latin America, there is a strong tradition of setting up CSOs, civil society organizations, and NGOs to work with the communities. So I gave you two examples of community engagement. One is a direct engagement by the community where they organize themselves in committees. And we can have many examples like social contract in Switzerland and other initiatives where there is a direct consultation between the community and the local authorities. The second one is through an NGO, civil society organizations, who represent the communities. Everything is contextual, but the last message that I would like to say is that even though WHO integrates community in all the programs, it's important that we understand that there are many models of community engagement. And unless you engage the community from the beginning, everything that will be top-down might have gaps, might not reach the objectives of public health that we intend to do. So it should be integral from the beginning. And with this, I would like to hand over to the moderator, Dr. Aranda. Thank you so much.
Dr. Fatin. I move on to Mr. Hisham Ruby, President of Ittijah. Mr. Hisham, how does Ittijah adapt its community engagement strategies to the specific needs and challenges of different local contexts? And what are some examples of successful initiatives that have been implemented? زي ما تحب.
ازيكم. Actually, I'm very happy for this invitation. UNFPA is our main partner at the ITJAH and the Ministry of Health and Ministry of Youth. To answer your question, I need to start what is the foundation principles of ITJAH. When I first thought about creating an Egyptian NGO working mainly with young people and youth, the idea was I felt like young people and youth, they are not living in programs. They're living in life. So if we set together, create a program and try to implement it with a specific community or a specific group of young people, this will not lead to, for my vision at that time, this will not lead to anything. And we will just continuing to implement activities. So from day one, we adopt an approach. We call it community youth development. This approach means we are not only thinking about community development and youth development apart from each other, but it is community youth development approach. This means like when we want to go to a specific community and we work with a specific group of people, we work with them to identify the assets exist in the community and the needs, and then we think together about doing something. So if you think about a young person, and this young person, we all together want to help him or her to be much more empowered. You can do this in two ways. Either you give him or her a lot of like information, training, skills, or you're trying to work with him or her to develop their surrounding community. In this sense, we build the leadership inside this person. In the same time, we help him or her to understand about the community, and then this will help the person to be much more empowered and much more aware of himself or his community. So this is our approach. It's community youth development. So we never develop programs in the office and then trying to implement it. And this is also how we work with UNFPA specifically in the population clubs. We had this idea to start population clubs inside youth centers. Youth centers all over Egypt, like 5,000 youth centers, mainly place for sports activity and some social activity. With the Ministry of Youth, UNFPA, we thought to create a population club inside each youth center. Now we reach like more than like 400 across Egypt, and the main idea behind this is to learn from young people in the community inside the youth center, inside specific village, and to think together how can we think about activities, how to implement these activities, what kind of tools we need to use. Sometimes we discover they like to do this using art, theater, singing, or using different tools. And we feel like, Tijah, we feel like we are part of this process. UNFPA very supportive to this, and they also working with us as on-ground partner. So we are not having this relation with like it's not a donor implementing partner relation. It's a partnership, and also the Ministry of Youth is very flexible, and they open the youth centers for us. They give us the opportunity to choose the villages, to choose the youth centers we work with. So when you think about the idea of engagement, community engagement, this means we are two partners and we need to engage with each other. And this is for us, for Ittijah and UFB, it's not the case. We are one team. We work together. We think about the youth and the community in the same time. We also think about the institutions inside the community with us. So it's not only we think of developing young people or developing the community. We're also looking to develop the youth center. So an institution in the community is very important aspect to think about when you think about intervention or you're trying to implement an intervention. So we adapt community youth development in all our thinking, in all our implementation, and our partnership with UNFPA make this real, and our partnership with Ministry of Youth make this national. So we're doing this all over Egypt, and we are very happy that in each specific time when you ask a young person working or doing something during this activities, or with they call it packs or population clubs, they will not talk about a beneficiary in this project. No, this is my role. I am the one who leading the theater. I'm the one who creating songs. I'm the one who creating awareness sessions. So they feel they are part of this. So sometimes they feel like they are, what they do, they are engaging us. We are not engaging them because they are the owners of everything. And to be honest, to have this partnership and to have this approach where organization like UNFPA or even a government organization like the Ministry of Youth allowing this to happen, and this happening because the results is very promising. When you go to one of the population center in any village across Egypt, you will feel the momentum. You'll feel this is happening, and this is very effective. I encourage all of you to think about community engagement in a deeper way. We can call it community partnership. We can call it other, because the engagement feel like we are two different communities. And I think I give an example, a very good example. This example started, I think, maybe 2014, 15. Here, the leaders of UNFPA are with us. They can remind me, but it's an experience where you will always be proud of. It's not like a 1 year initiative. It's not like an initiative, an activity. It's a very well designed intervention in partnership with the community, with young people, with the institutions inside the village, and with the government in terms of Ministry of Youth. So, and this is applied in all things Ittijah doing. We work in this and work also in different kind of activities, but you will find the same concept, the same philosophy behind thinking of an initiative is it's not the community itself, it's not the population we work with, it's not the community, and it's not even the partner, it's all together. And to help a person or young people to be much more empowered, you need to think about his surrounding, his community, his family, his education, and also to use his assets, his skills and assets within the community. This will create a different kind of leadership, and this is what we all looking for. We look for a different leadership in the community level, and this will lead to a different community and a different sustainable development results.
Thank you, Mr. Hisham. Indeed, involvement and teamwork is the base for the feeling of belonging and motivation. Thank you so much for
Thank
this
you.
insightful response. Moving on to Mr. Vito Intini. Mr. Vito will be delivering a presentation on community engagement for sustainable and inclusive development from the financing angle. The floor is yours.
Thank you. Thank you very much. Good morning. It's a pleasure being here. I'm looking for the remote control. Okay. So community engagement has many dimensions, many aspects to be considered. They can be at the national level, central level, at the local level, regional, provincial, and the community, local community level, and across many dimensions. One of those dimensions is finance. Finance is like you can have nice plans, a nice car, but finance is like the fuel of that car. Without proper, conducive, sustainable financing, you will not go that far in those processes. But let's start from general considerations. Here you have two charts from the Arab Barometer, the latest raw data, on the share of respondents who thinks that government respond to what people want, divided by gender on the upper side and by age groups on the lower side. Here you see the average is above 20% for both categories, male, females, and also youth and adults. But you see a lot of differences across countries, right? Like the case of Lebanon is quite telling that there is no trust in what basically being heard. Other countries have higher shares. But then you see a bit of difference, for instance, in the case of Tunisia, between youth and adults, where youth think a bit less that they are heard in terms of their needs. Using another indicator, again, Arab Barometer, which is an important proxy for socioeconomic empowerment, which is an important dimension of engagement. We look at aspects that are related to creating employment. So what institutions, if they are good at creating employment. Here, the average, if you see across the region, goes a bit down, quite a bit. And again, there are big differences across countries. In this case, there is not much difference between men and women, youth and adult. But the overall, it goes down. So one aspect to take that in consideration when we talk about engagement policies. Another indicator, this is from the World Value Survey, is having freedom of choice and control. So, which is what my colleague was talking about, agency, the empowerment part. Again, in this case, the averages go quite high compared to the previous one, but you can see the difference, for instance, in the case of Lebanon, between youth and adults, where basically youth feel more empowered, which is interesting. When you look at, this is the final one, on the top priorities overall, in terms of public opinion, of course, public opinion can change their mind from year to year, depending on the current situation. Here you can see that across societies, at least those for which we have data, these surveys, you can see that there is basically two priorities are coming up in the latest surveys that we have. One is border security, and the other one is inflation, which is a proxy for economic issues. But when we look at a specific aspect, which is giving people more say in important decision making, which is lower compared to the other two, you can see that there is a lot of variation among countries. Not much between women and men, not that much between adults and youth, but between countries you see a lot of variation. Of course, Lebanon is pretty high in terms of giving importance to decision making, having a say in decision making. So let's focus on the youth part again. This is another survey. It's always important to use multiple surveys to see if there are common trends, because again, as I was saying, it depends on the year. There is a lot of variation between years. Here you can see that on average, according to the Arab Youth Survey, more than half of the Arab youth that have been surveyed in the last year's survey feel that their voice is not really heard. And the trend has been going down in the recent years. And there is a huge variation between three sub-regions. The Gulf, North Africa, and North African Levant, they are pretty similar. The real difference, starting differences between the rest of the region and the Gulf. So those are perceptions. Again, they can change over time, but there are important aspects that I was talking about at the beginning of my introduction. So public finance is one of those critical aspects. There are two important indicators to bear in mind. One is budget transparency, because it's enabler of participation, of citizens' participation in budgeting processes, and the principle of public participation in fiscal policies. Here, and this is, I was showing in another session, you can see a lot of middle-income countries, but also low-income countries are performing very well. All these green lines are saying they are performing more than the minimum threshold required. They are performing pretty well. So it's an evidence that budget transparency is an important and also an achievable objective. When it comes to public participation, the average globally goes down. Only one country goes above the threshold that the budget survey has established. And then you have a number of countries that are improving, but still a way to go. So one important aspect is this budget participation, participatory budget, that probably many of you have heard of. This was launched, initiated very much at the local level. That's why the local participation dimension remains critical, but can influence positively the national processes. Of course, Brazil was an initiator initially in the end of the 80s, Porto Alegre, gathering, involving citizens in the participation process to establish priorities and have those development priorities reflected in the municipal budget. But then you have example in Toronto, Madrid, many countries around the world. One in Kenya that is an interesting one to look into, and one in India, Kerala, which is a state, so it's more at the state level, where participative budget has been used in the recent past systematically. So why this is important, participation, citizen participation? Here, this is a study that we did, UNDP, ESCWA, and UNICEF in the region, where you can see who are the beneficiaries of subsidies, of social policies. You can see there is a big focus, the gray bars, on households and families, and then on communities. But when you look, for instance, at people with vulnerabilities like disabilities and women, you don't see much, because they are captured by other groups, other categories. And actually, those are aspects that are important to consider. Having these groups, categories participating in the process may help also a more efficient and targeted subsidy and expenditure allocation in more general terms. So this is what the gender responsive budgeting is about. Again, there has been a lot of history by now, 20 years and more, of gender responsive budgeting. Around over 100 countries have been adopting. Basically, the idea is to have a proper analysis on the priorities that will help women's socioeconomic emancipation through the budget preparation, budget execution, monitoring, and reporting mechanism. with clear key performance indicators. This is the importance, the essence of performance and impact in a budget process. Many countries have been using it. In India, Mexico, for particular education, on health, on infrastructure, in Austria and Ecuador, on the accountability to report on gender expenditure. One important and useful example is Rwanda, that has done a lot of reforms to that effect. It's a systemic change that can improve that allocation of part of the budget for women's specific need. As I was saying, the state of Kerala has been quite a champion on that. You can see that the budget allocation specifically for women's related development needs has almost doubled in just 5 years. In Morocco, in the region, we have gender responsive budgeting that has been initiated more than 10 years that the gender dimension has been introduced in the budget law. And there is a budget report on annual basis that is done. This has proved to have shown a better allocation of funds and resources, particularly in the education and healthcare sector. So one other aspect is the so-called intergovernmental fiscal transfers, which is transfers from the central government to the local government. Those are critical. All countries have this kind of transfers. They are useful for vertical and horizontal equalization, we say. So equalization between resources at the central and local level, but also across the local level. One important aspect of these is the performance-based government system, PBGS. One of the indicators that are used typically in these allocations are related to engagement and participation of local communities, like this one, the ones that I highlighted in the red box. So this is to tell you that all these different bits and pieces need to come together. Another bit is taxation. You need to have a fair taxation in order to allow further socioeconomic empowerment and participation. Typically, income tax and consumption taxes, VAT, very often do not take into consideration, for instance, the gender component. If you are the wife of the main income earner and you are considered a second income earner within the family, the treatment in terms of income tax is different than being considered an independent income earner. You might have additional tax rates applicable. When it comes to consumption, some of the consumptions that are related to women and children may have a different VAT sales tax applicable. So those aspects need to be taken into consideration. At the local level, I don't need to dwell much because my colleagues have already talked about it, but there are 4 components that are important approaches in terms of participation. And this is in broader terms. Consultations, community consultation, access to information, which is what I was talking about in terms of a budget, but of course it's in broader terms as well. Mobilizer, identifying community mobilizers that can also connect and facilitate that access to information. And village community committees. We have them through our project in a number of countries, both crisis and non-crisis affected countries that have shown to produce results. Important to consider. One important aspect is corporate social responsibility. So now we look at the private sector part, contribution. So far we have talked about the public finance, but private finance is as important. A lot of these initiatives are done through corporate social responsibility of private companies. Here you have an example through NGF, a Global Environment Facility project that UNDP is doing in Egypt. Here, and this is important at the local level, sometimes mineral-based companies or companies that can contribute to the state budget at the central level, but the negative externalities can be at the local community level. So it's important to bring the local community to address those negative externalities and even further push up the development trajectory of those communities. This is an example we have done in Iraq, supporting also a training program and micro, small, and medium enterprises. We have other examples, but in this case, it's more PPP, not corporate social responsibility, just to tell you how, in different perspectives, how we can engage with the private sector as well, and also with the new financing mechanism that can be
Sorry,
put in
Mr.
place.
Vito, but the time is running.
Yes,
We need to conclude.
I'm closing up.
Okay.
This is trying to bring all what I told you as an example together. Where you put public and private finance also at the local level. This is Punjab, a region in Pakistan, integrated local financing framework and strategy that basically is bringing international financial aid, domestic private finance, international private finance, so also FDI, and the public finance at the domestic level together to address some of the priorities that the government of Punjab, together with the local communities, have identified. We hope we can move in that direction as well. Thank you.
Thank you so much, Mr. Vito. So our last intervention is a question for Mr. Hisham Rubi. Mr. Hisham, how does Ittijah measure the impact of its community engagement efforts, and what are some of the key indicators that you use to assess progress towards sustainable development goals?
Thank you. When we talk about impact, we see it in it's a different layers of information. Definitely, we have system in place. This is also in partnership with UNFPA to gather information, to analyze the information, and to also learn from the information we gather. But I personally, I'm into community hearing. So you can find a piece of information looks very good, but to go deep and to understand the real impact happening within the community, within the youth center, within the young people themselves around their idea and their concept they use in their life, you need to be in, you need to have a human interaction. So we have both. We have system in place where a lot of young people across Egypt collecting data based on what's happening daily, and then putting this in a very specific system and trying to analyze it and to develop a set of information and learning, and we all have a say, and we work together in this. So it's not like a silo or task where only Ittijah do this or UNFPA supervise this. It's a comprehensive approach to understand the information and to think about it and to see how can we use it in the development of the new plans every year. So we have this, but what I'm very proud of is the community hearing part, and this is very clear when we meet with young people in their activities. At some point, they have the theater initiative. They create plays and they write it and they sing it and they create songs and they write songs, and when you have this human interaction, you understand more about the impact, because this is just listening to a group of young people, for example, from Aswan or Kenya, talking about their future plans, you will feel how much impact our work help in this. And to look also on the coverage. When we start this, I'm going back to this population clubs inside youth centers. When we start, the idea was to start 10, to choose 10 governorate and start one each governorate. Now we have more than 400, and the plan to go more and more and this has become a very stable function in each youth center we work with. So this is also, you can call it a real impact. And I'm sure you all know that we cannot measure impact after 1 year or 2 years or 3 years, but now we are 10 years and more. And this is give us the opportunity to really understand what's happening, to really learn what we need to do in the coming period. So this is very important, and this is the main source for our learning in Itija and as a team. When I say a team, the team is Itija, UNFPA, and Ministry of Youth. We work together. So we learn through this kind of information, and also we learn more through the community interaction and community hearing we do with young people and the community.
Well,
Thank you.
partnerships give power and give sustainability indeed.
Definitely.
Well, the time has passed so fast with you. Thank you, esteemed panelists. Your insights were amazing. I hope next year we meet again and share the goals and achievements that we were able to attain. Thank you, everyone. Thank you so much.
Thank you. فرصة سعيدة.